I'm Giorgi Kanchelashvili. I'm from Tbilisi, Georgia. I'm an epidemiologist and biostatistician. And I work at Health Research Union, which is the one greatest NGO in Georgia. We conduct several studies about infectious diseases. I'm also a trainee at Emory University, and our project conducted this study several months ago, which is about hepatitis B co-infection and awareness among patients with active tuberculosis in Georgia. So I don't have any conflict of interest at all. So as I mentioned, this study was conducted in Tbilisi, and this is a Emory Georgia TB research training program, and we collected our study participants at the National Center of Tuberculosis and Lung Disease in Georgia. So I just want to start from the introduction section. So we know that tuberculosis and hepatitis B infection are two significant infectious diseases that have posed considerable challenges to global public health. In Georgia in 2021, we had almost 1,700 new cases of TB, and according to 2021 study, which was a seroprevalence study, it was conducted by CDC, United States CDC in Georgia. They have found that the HBV anti-HB core prevalence was almost 22%. And among this 100%, 2.7 had chronic hepatitis B. I want also to mention that we have a hepatitis B national program in Georgia, which has started several months ago. It covers free vaccination program for all susceptible patients. Also, it covers free testing, rapid tests for Georgian population, and also free medications for patients who have chronic hepatitis B in Georgia. And also we have hepatitis elimination program, as Dr. Andrew mentioned, and presented the main findings, the results. So HBV vaccination is one of the most effective preventive measures against hepatitis B, and that's why we just collected the information about this topic. We know that both infection has a different transmission routes, but latent tuberculosis infection prevalence among adults with chronic HBV is notably higher compared to the general adult population. And co-infection of those two infections is a pressing concern given its potential implications for patients' management and outcomes. Our main goal was to determine the prevalence of chronic hepatitis B infection and evaluate self-reported HBV vaccination status and the willingness to receive HBV vaccine among patients with active tuberculosis. So, as I mentioned, it was a cross-sectional study, and we had several inclusion criteria. The age must be more than 18 years, and also the patients must have the active tuberculosis. And all these patients taking treatment for any kind of active tuberculosis at National Centers of Lung Disease facility. So in total we had 110 patients, and we have tested for HBs antigen, anti-HBs, and anti-HB core tests just to find the proportion of chronic hepatitis B and proportion of patients which need the vaccination, and also the proportion of patients who had a natural immunity against hepatitis B. Also, we had a questionnaire on HBV infection, vaccination status, and willingness of HBV vaccine. We did several statistical analyses, described our sample. We did biovariation and multivariation analysis to find the association between HBV and TB status and various social, demographic, clinical, and behavioral variables. So in total, we have found that 4 patients, which is 3.6%, had chronic hepatitis B, anti-HB core positive results have found among 19%, and among these 110 patients, only 14.5% were willing to be vaccinated. And here, main barriers presented. So almost 35% declared that the main barrier was safety concerns, that this vaccine is not safe for their lives. 23% mentioned that this vaccine is not effective, and 20% thinks that this vaccine has an infection risk. So here are our main findings from test results. Out of these 110 patients, 28 had positive test results. Out of them, 7 had vaccine-induced immunity, 14 had past HBV infection, and another 7 had past HBV infection but without anti-HBs positive results. And in total, we have found 4 patients with HBs antigen positive test results. So, in conclusion, I just want to mention that we have found a low HBV immunity in our sample, and that's the main reason why we need to integrate some HBV services and routine screening against hepatitis among the facilities where we have the patients with active tuberculosis. And the main finding also is that we have a knowledge gap here among those patients because they have we have limited vaccination uptake, and we have a low level of knowledge about HPV vaccine. And we need to just increase the we need to just do the educational campaigns to improve the awareness about hepatitis B vaccine. So I want also to mention some statistical information about HIV because this is a relevant information for you regarding the HIV. So our NGO, my NGO, we conducted several IBBSS studies, which is the integrated biobehavioral studies, and we have found that we know that we have a low prevalence of HIV. It's 0.4 in Georgia, but we have a high problem, great problem among risk groups, which are MSM population and transgender people. We have found that among MSM population, it's 15% prevalence of HIV, and among transgender people, we have 8% prevalence of HIV. Okay, thank you very much.